Kane, and I'm here with you for HIT 340 Comparative Records. We are now on week 12 and we will be covering chapters 14 and 15 this week. If you take a look at your syllabus, you will see we really don't have any unit objectives for this, but these are two chapters that can benefit you just simply from the knowledge. So I'm going to go ahead and do this lecture video for chapter 14, and then there will be a subsequent one for chapter 15. Our learning objectives according to our book this week are to identify the different practitioners associated with dental care and describe their roles, look at documentation requirements specific to the practice of dentistry, explain the benefits of electronic dental records, discuss the potential impact of managed care on dental practices, and describe utilization management strategies used in dentistry. We will also look at specific risks associated with dentistry and strategies to manage those risks. We will list the information needs of the dental office and identify important components of electronic dental records and practice management systems, as well as describe potential career opportunities in the dental setting for HIM practitioners. So what types of dental settings are we looking at? There's the solo dental practice, which is now moving more to a DSO model, and we'll talk about what that is. A group dental practice, clinics and academic institutions, third-party organizations, i.e. managed care, acute care hospital settings, and then others are prisons, military bases, Department of VA, colleges, universities, and community health centers. And if you are following along in your book, you will want to be on page 508, moving into 509 here. All right. So, sorry, I guess thought there was another slide there and there isn't. Okay, so I wanted to touch base on the solo dental practice. This is a practice that's owned and operated by one dentist, where the dentist owns or leases the office building or suite and all the necessary equipment and furnishings to run what is in essence a small business. The solo practice dentist frequently employs several personnel consisting of at least a receptionist and a dental assistant, but may also employ an office manager to oversee the day-to-day business operations of the practice and an insurance specialist to keep up with the filing and adjudication of claims. Dentists may employ a full-time dental hygienist or contract with a hygienist to come to the office one or several days per week to provide either routine preventative care or definitive periodontal treatment. Some dentists elect to perform routine checkups and cleanings themselves. The solo practice setting has been remarkably stable over the years despite increasing competition. This is beginning to change as more recent graduates have significant educational debt and cannot enter a solo private practice, or they prefer to be an employee and not have to worry about managing a small business. And this is the same as physicians as well. So dental service organizations are emerging in which a dentist may have an ownership stake in the practice while the DSO manages the administrative duties of the practice. Data from the American Dental Association from 2013 revealed that 6.4% of dentists report that their practice is now part of a larger multi-location entity, and that's up from 5.4% in 2008. And I'm sure that's even closer, even higher today when you look at 2020. Anyway, you can start going through the pages and see what a group dental practice is, and then how there's clinics in academic institutions, how dentists and patients participate in third-party organizations to assist patients in paying for dental services. There are dentists who have privileges in acute care hospitals and perform procedures there. And then, of course, as we talked about in some of these other settings that we've already studied, dentists may be involved there. Types of patients. Lots of children and adolescents as well as adults. With children and adolescents, they're focused on cavities or dental caries, their primary and permanent teeth, and orthodontia, i.e. braces. With adults, there's sometimes a focus on root canal therapy and crowns, periodontal disease, or cosmetic dentistry. When it comes to pregnant females, they need to make sure that they avoid exposure to radiation and that they maintain cleaning and checkups. In terms of the elderly, there has been a trend toward keeping natural teeth. Although dentures still exist and are definitely being used, they are implant stabilized now or implant retained sometimes. And then there's definitely a need for dental care at nursing homes. And then patients with special challenges also require dental care. On page 515 in your book, it talks about dental needs of residents in nursing homes. Figure 14.2 shows that 72% of residents in nursing homes need routine oral hygiene. 46% suffer from adjustment of loose or are in need of adjustment of loose dentures, so they are suffering from loose dentures. 43% have periodontal problems. 36% have root caries or root cavities, and 10% struggle with dry mouth. So you can see how they would have those needs. And then patients who are physically or mentally challenged also have dental needs. And they may struggle to cooperate with a dentist, can't understand simple commands or follow those. They may not be able to sit still for the length of time that's needed. So sometimes they have to have deep sedation or general anesthesia, and that means that they might be treated in a hospital setting. Types of caregivers, and this begins on page 517 in your book. Dentists are usually DDS or DMD. Dental specialties where additional training is required is for orthodontist, periodontist, endodontist, prosthettodontist, and oral maxillofacial surgeon. An oral maxillofacial surgeon is actually an MD. There are dental hygienists. We talked about those. They really focus on the prevention of dental disease and are under the supervision of a dentist in most states. There are some mid-level providers that are licensed in a few states to perform certain clinical procedures. May include someone like a dental health aid therapist. Then, of course, there's dental assistants. Professionals who provide dental care in the United States are regulated by the individual states. They have to have licensure in the state. Each state is responsible for their licensure activities, and they have to have all of that. Dentists have to have a DEA number and an NPI number in order to write prescriptions. They must report adverse effects, physical abuse, and cancer. So please note those. And this is on pages 522 to 523, where it goes into a little more detail. So what do dentists document? Well, patient information, medical and dental history, head, neck, and intraoral exams, dental exams and charting, and then periodontal exams. They also take x-rays, those dental radiographs, and intraoral photography or photographs. Treatment plan, treatment notes, patient education, diet evaluation. Those are all things that they need to document. And again, be thinking about documentation and how that ties in with reimbursement and with any type of regulation. And in your book, the specific documents start on page 523 and go through 531. They show you some screenshots of dental health information systems that you can see where they're documenting the different pieces of information in there. They look very similar to an EHR, but they're really designed for a dental office. Well, we talked about how documentation is needed for reimbursement. Let's talk about reimbursement. Dental insurance is very common now. Although there still are self-pay patients, there are HMO plans, and CMS has some dental benefits for children through the Medicaid and CHIP programs. And Medicaid is paid for partially by the feds and partially by the state, remember. Um, and occasionally some states do cover dentistry for adults, but otherwise dental benefits are excluded from Medicare. So you need to know that, those details. TRICARE, which is the VA, does have a dental program, and of course the VA has dentists on staff and provides dentistry services to all of their service members, both active, retired, and discharged. So in terms of information management, we're now on page 534 in your book. There are coding classification systems. The current dental terminology is published by the ADA. It's used to file dental insurance claims for patients, used by dental schools, dental hygiene training programs to collect statistical data. So in the office setting, they're using CPT, HCPCS, and CDT, this current dental terminology. So make sure that you're aware of that, and you're noting that. Hospital coding, of course, follows the rules of the payer for the provider type and setting. So if it's inpatient hospital setting, it's going to be ICD-10-CM and ICD-10-PCS. If it's outpatient, it'll be ICD-10-CM and CPT-4. Electronic information systems are in use by over 95% of dentists. They've really embraced electronic health records. They do have practice management software that gives them the capability of doing electronic patient registration, appointment scheduling, insurance billing and claims tracking, patient accounting, patient recall reminders, patient referral practice reporting, and inventory management. And you can see some of this again. They've given you screenshots of what, for instance, schedules and that sort of thing. You can see that on page 536. Most dental offices have multiple computers. There's usually a computer at each patient chair. If they have a separate radiology area in private offices, as well as reception and business areas. Because they do take x-rays, some have digital imaging capabilities. And for dental professionals who don't want to maintain an office network or handle hardware software upgrades or be responsible for daily backups of data, they oftentimes contract with an ASP, an application service provider, and through an internet connection, they provide the practice management software in a hosted environment, sort of like a cloud computing. Quality improvement, this is on page 540 in your book. They do have peer review programs that are promoted through the ADA and some state dental associations. They have clinical dental practice guidelines published by professional organizations and the ADA Center for Evidence-Based Dentistry. HMOs and managed dental care organizations are also measuring quality using quality indicators. Utilization management occurs in dental offices. They have to do pre-treatment authorization, evaluation of medical necessity of treatment. Preventative care is encouraged, and there are coverage exclusions that dental offices need to be aware of, as well as the patients themselves. There are risk management and legal issues that have to be considered in dental offices. These include injuries to caregivers and patients, malpractice and negligence, adverse reactions to medications and dental materials, and dental records that are used for the identification of individuals. What is the role of the HIM professional in the dentistry world? Well, we definitely have skills that are important in dental practice. We are very up on information technology. We can help them with managed care and insurance, including electronic billing, revenue cycle, utilization review, data analysis for business decisions. We can help with quality improvement. Sometimes academic institutions want to have an HIM person involved because their background and ability to cover multiple areas. And then integration and exchange of information. Some trends, dental service. In terms of dental services, dentist to population ratio continues to decline. Managed care and PPOs are heavily involved in dentistry and will continue to be so. Dental treatments are tending toward better prevention. Dental trauma and sports dentistry has increased as specific fields within dentistry. Dental implants, cosmetic dentistry, adult orthodontia, dental anesthesia, and oral devices are also trends in dental treatments. Technology will continue to increase in dentistry. It's amazing that they're 95% of the way there, but that will probably still increase. Digital radiography, intraoral imaging, computer modeling of prosthesis, and displaying after-treatment appearance. Those are all things that are now available to dentists for them to use with their patients. It's a matter of implementing those on a more widespread basis, but you may see those at your dentist office already. And then dental informatics. And that's the application of computer and information sciences to improve dental practice, research, education, and management. And it continues to grow. Bioinformatics is another emerging interdisciplinary field of science incorporating the principles of biology and computer science. It involves collecting, storing, retrieving, and analyzing large amounts of biological data from a variety of data sources. Oral pathology is one dental field that has benefited significantly from the evolution of bioinformatics with advancements in diagnosis and treatment of diseases. And this is on page 546 in your book. So in summary, there are increasing opportunities for HIM in dental settings. EHR is an integration with electronic dental records are areas where our skill sets would be very helpful. Managing dental care plans require better information systems and individuals to manage the revenue cycle. And also you think about data integrity, security, privacy, all of that. And then treatment and technological advances. Interoperability is still, is still a need, even in the dental field. Some web activities, if you're interested, you can pursue these. And I think those are listed in your book at the top of page 548. And that is it for this one. So I will be back again shortly, and we will talk about chapter 15, which is veterinary settings.